So we're going to be talking about the HIV and AIDS vulnerable population. Speaking is going to be Courtney, Samuel, Cesar, Kaya, and myself, Kate. So HIV and AIDS affects approximately 36.3 million people worldwide, and new diagnoses are primarily seen in the ages 25 to 34. It's more prominent in males, and the highest rate is in African Americans. The US alone accounts for 1,189,700 HIV cases, and 17,722 of those are in Tennessee. The LGBTQ community is the most affected. So this graph really just talks about the decline of HIV prevalence in the United States. There's a lot of measures that are being undertaken on all prevention levels, primary, secondary, and tertiary, that are increasing in efficacy. And then this graphic just represents the incident rates by ethnicity within the US. This graph is telling because the racial groups with the highest rates often have the least access to healthcare. And this is just another chart comparing the incident rates in terms of race and ethnicity in the US compared to the rest of the world. So there's a lot of concerns with individuals with HIV and AIDS. Many barriers exist that lessen the effectiveness of care and interventions for the HIV/AIDS community. Many face discrimination within their community, especially in the South, because it's the Bible Belt, and this makes it really hard to motivate people to be screened and seek treatment. A lot of people suffer from depression because this diagnosis is life-changing and sometimes even terminal, and this affects people's psyche. So some cases suffered from mental health conditions prior to their diagnosis, but every patient should be screened for their suicide risk. IV drug abuse is often a mode of transmission and poses a barrier long after a diagnosis. It's important to educate the patient on needle exchange programs if they're offered in your area, and provide resources for rehabilitation and ensuring they're set up with a psychiatrist. You should also educate on safe sex practices because this is one of the most common modes of transmission, and patients need to know that condoms are the only effective barrier for preventing STDs. Patients living in poor conditions are at an increased risk for other diseases and overall poor health outcomes. Patients need to be aware of grants that are available, such as the Ryan White program and housing opportunities for persons with AIDS. And then HAART is a tough medication regimen with very specific administration guidelines. For patients to see the best results, they require lots of education and help working around time barriers and schedules like school and work to make sure that they stay on top of their medication. And then lastly, if a patient is homeless or they don't have a car, they may experience difficulty making it to their doctor appointments or picking up their medications from a pharmacy. So it's important to ensure the patient knows how to utilize the available local public transportation services. And healthcare workers should know which barriers are in place for each individual patient and work with them to resolve this.
So the community impact, it impacts housing, geography, economics, social opportunities, food acquisition, healthcare, costs of medical care, and employment rates. So for housing, a significant percentage of persons living with HIV and AIDS struggle with housing insecurity. The federal government funds such as HOPWA, or Housing Opportunities for People with AIDS, and the Ryan White HIV/AIDS programs help to alleviate the number of diagnosed persons who are homeless. This is especially important when considering consistent and quality care. So geography, the distribution of HIV and AIDS varies by region. In order from the highest number of incidences to the lowest, South is 15.6, US dependent regions is 12.6, Northeast is 9.9, West is 9.7, Midwest is 7.2, and these are mostly located in urban areas. So the cost of new HIV infections is estimated at $3.6 billion, including $6.7 billion in direct medical cost and $29.7 billion in productivity costs. There are many social opportunities for people with HIV and AIDS. The local health department can connect you with group therapy sessions, but there's also online support groups and forums, LGBTQ bars and clubs like the Upper Cumberland Pride. So food acquisition, supplemental nutrition assistant programs or SNAP are available to those in Tennessee who may be on disability or are unable to pay for food. WIC, or Women, Infant, and Children's, is also available to support families with food acquisition, especially those who cannot breastfeed due to an HIV infection. Another important thing to note is that people with immunodeficiencies need to carefully prepare their food to prevent secondary infections from unwashed fruits and vegetables and undercooked meats. So healthcare, antiretroviral therapy can decrease the viral load and decrease the chance of transmitting HIV to others. Pre-exposure prophylaxis, or PrEP, is also available to those who are at high risk for HIV exposure, such as men who have sex with men. Early detection of HIV through screening high-risk individuals, needle exchange programs, and safe sex education, which involves wearing a condom every time you have sex, are other advances in HIV care. The cost of medical care, an average lifetime cost per person, is estimated at $420,285. Unemployment rates, people with HIV and AIDS, 37.7% of people with HIV are unemployed compared to the national average unemployment rate of 11.7%. This is caused by many factors, including stigma, discrimination, restrictive policies, and ill health. Being unemployed can severely limit access to health care due to loss of income and insurance plans.
Okay, so there are basically two big public policies made for the HIV and AIDS epidemic. The first one is the National HIV and AIDS Strategy, which was first made in 2010. It has been recently updated under President Joe Biden. And the second one is Ending the Epidemic, A Plan for America. That was created in 2019 by President Donald Trump. Both of these plans are pretty similar and have similar goals. They both encourage more testing for at-risk individuals, and this really impacts us as nurses by allowing us to be a little bit more comfortable talking to our patients about decreasing these risk factors, such as taking PrEP for high-risk individuals, safe sex practices, and safe needle practices. Additionally, both of these plans include hoping to end the HIV and AIDS epidemic by 2030.
So available community resources, like we mentioned before, the Ryan White program and the Housing Opportunities for Persons with AIDS. These are the only federal programs designed to care for HIV and AIDS specifically.
So kind of some things we need to talk about is the need for community resources. The first thing we want to talk about education. Education is not just for the people who are going through HIV and AIDS, but education about, especially in high school or college, where common sex is more advocate. And we need before of our own biases and in the medical team. Second will be public funds. Like we know, any medical problem there's costs and payments that need to be covered. So by having a public fund, we can help that cost of treatment, transportation, other costs those patients need. Something that helps with anything with a patient with chronic disease is having somebody who knows how it feels to go through that treatment. So peer groups are great to have for people who have AIDS and HIV, to have a safe place to open about what they're going through and kind of help and advocate for one another and have a place where they can feel like at home. Mental health with anything needs to be addressed, and something that is being addressed with LGBTQ plus has been on the decline. So we need to have that space where they can talk about their emotions and their state of mind and how this illness affects their longevity. And at the end of the day, we need to talk about this disease can cause death, and we need to be aware of proper planning of burials of what they want to have to happen with their body if they do pass away with this disease.
Healthy People 2030 addresses the HIV population in a number of ways. They have stated goals of increasing the knowledge of HIV status for those who are infected. Additionally, they seek to reduce the number of new HIV diagnoses and increase the linkage to those who have received a diagnosis with appropriate care, and then increasing viral suppression for those who have been diagnosed and received care. For their first goal of increasing the awareness of those who have a diagnosis, our most recent data shows that 85.8% of those over 13 years old and living with HIV were aware of their infection. Our target is 95% right now, so there's still work to be done on that front. For number of new cases per year, right now, our most recent data is 38,351 diagnosed in 2017, and our target is 3,835. And that'll be done by increasing viral suppression for other people, increasing linkage to care, increasing knowledge, and having people being tested more frequently, especially those who are at high risk. For linkage to care, the Healthy People 2030's goal is that 95% of people who are diagnosed will be linked to HIV medical care within 1 month of their diagnosis. Right now, that number is 77.8%, and their target is 95%, which again will be accomplished by them increasing testing, especially in high-risk communities, performing education, reducing stigma, and helping people to seek the care that they need. And finally, the viral suppression numbers, our most recent number that we have available is 63.1% of those who have HIV or have reached a virally suppressed state. And their goal is 95%. And with that, important factors are keeping on top of adherence to drug regimens, making sure that people have appropriate access to care, making sure that people are being visited with, and making sure they're doing okay mentally with their diagnosis. There's a multifaceted way that you have to go about that, but right now we are still coming short with the goal of improving.
And these are our references.